The U.S. rolled out plans to distribute a COVID-19 vaccine to Americans free of charge ahead of a Senate subcommittee hearing on the coronavirus response yesterday. CDC Director Robert Redfield said he expects the first doses to come out in November or December if testing continues on its current track, but warned it could take several more months before the vaccine is fully making its way across the U.S. He also explained to lawmakers why it was important for Americans to keep masks on in public.
I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine, because the immunogenicity may be 70%. And if I don't get an immune response, the vaccine's not going to protect me. This face mask will. So I do want to keep.
Internal medicine Dr. Shoshana Ungerleider is here with us now to discuss. So Dr. Ungerleider, as I was listening to Director Redfield making those comments and holding up the mask, where he essentially said that the mask is probably the best way, even more so than a vaccine, to protect yourself and to protect the ones you love. It made me think, and I think I mentioned this to Anne Marie, it made me think that, the efficacy of this vaccine may not be 100%. In other words, it may be similar to the flu vaccines that we get, which is that, they protect us somewhat, but there's always the possibility that you could still get the flu even if you've been vaccinated. Is that, like, again, I'm not a doctor, so I'm just sort of thinking about this the way a layperson would.
Yeah, Vlad, that's right. We still don't know how effective the COVID vaccine may be. And honestly, it isn't really a question at this point around mask use, right? So what he said being that masks are, potentially more important than a COVID vaccine is accurate. So public health experts, and the data really support that wearing masks dramatically lowers the rates of infection and hospitalizations from COVID. So I think regardless of the messaging coming out of the White House, mask wearing and social distancing along with good hand hygiene all continue to be necessary to stop the transmission of COVID, while we wait for a hopefully effective vaccine and, with the goal of getting our lives back.
Doctor, still on the potential vaccine, the federal government released a playbook on its plan to provide free COVID-19 vaccines. And it says that most vaccines will require 2 doses. So most people remember having to get their booster shot. But can you sort of explain why that's necessary with some vaccines?
Yeah, Anne Marie, that's right. So a COVID vaccine at this point is looking like it would likely be in those 2 doses. And that's really for a number of factors, getting back to that idea of immunogenicity. It's not completely clear at this point, given that those phase 3 trials are still ongoing, how the duration between those 2 doses and how that's going to play out for folks. What I will say is that it's challenging for a number of reasons, right? So the number of necessary doses doubles. So in the US, we'd need potentially 660 million doses for 330 million people. So you have to double everything also in the supply chain, syringes, vials, needles, and then the logistics, right, of having people come in for 1 dose and then another dose. We do this with a number of other kinds of vaccines. So recognizing the significant challenges we face, right, if a vaccine candidate emerges this year, and that's still an if, it's really no wonder that Dr. Redfield said it will really take until the 2nd or 3rd quarter of 2021 to start seeing results from a COVID vaccination.
So is there a chance that COVID-19 could evolve, making a potential vaccine obsolete over time, similar to the flu, which you need one every year?
Right. So viruses mutate. They change over time. That's really normal and expected of all viruses. At this stage, we can't really predict how COVID will evolve or how it will respond to a vaccine. We definitely have reason to think that, much like the flu, it will change year over year, and we may need to shift the vaccine strategy and how we go about combating it. So, again, we know that viruses do evolve, and if they're replicating and transmitting, in other words, basically what we want to do at this point is do our part to slow down the transmission of COVID with our behavior. So continuing social distancing, staying home, washing our hands, and wearing a mask all will contribute actually to how this virus may evolve over time.
So, Doctor, we've talked here about what we're sort of aiming for is herd immunity, and the best way to achieve that is through a vaccine. It's controlled, and fewer people will die as a result of it. But what percentage of the people in this country need to be vaccinated to sort of get to that level where the vaccine is effective?
Yeah, that's a great question. So the idea being that somewhere around 70% plus need to be vaccinated in order to achieve herd immunity. At this point, I'm quite concerned, given the vaccine hesitancy of many Americans, that it's going to be challenging to get to that point if we do, in fact, achieve a vaccine candidate. So all the more reason we need to be, reliant on the science to lead with data and really encourage people that vaccines save lives, they're safe, they're effective, and of course we need to continue on the course of the regulatory lines in order to get a really safe and effective vaccine approved here.
The CDC has also found that adults who tested positive for the coronavirus were twice as likely to have dined at a restaurant within a 2-week period of falling ill. And this was sort of eye-opening to us because it looked at a variety of things that people may have done leading up to their diagnosis, and it discovered that the one thing that they all had in common, those folks who tested positive, was dining inside of a restaurant. So, I mean, again, we've talked about this, Dr. Ungerleider, for 6 months, but explain once again to our audience why perhaps being indoors with crowds and not wearing a mask could be potentially problematic.
Well, Vlad, this was a relatively small study. It looked at around 300 people, half of which, as you said, tested positive for COVID, and the other half tested negative, sort of served as a control group. So all things being equal, right? So the positive cases, like you said, were about twice as likely to report that dining experience at a restaurant. We unfortunately don't know if they dined indoors or outdoors. I think that the takeaways really affirm what we already know. COVID spreads in the air. We know the highest risk places are indoor spaces with limited ventilation, right? We do believe that the virus can live in the air for up to a few hours. And additionally, in places where people are not wearing masks, and able to be physically distanced, are the highest risk places for transmission, which is essentially a restaurant indoor dining experience.
All right, Dr. Shoshana Ungerleider, always great to have you, doctor. Thank you so much. Appreciate it.
Thank you for having me.